going to start very soon. It looks like we're live now. So great.
Awesome.
Wonderful.
Well, I am happy to take the wheel and drive right now for a second. So for everybody that's joining, thanks so much for tuning in. My name is Jen Nye, and I am the Communications Director for Whole Washington. And as somebody that can appreciate good messaging, I'm a little awestruck that I have the fortune to introduce the featured author of our third installment of the Whole Washington Book Club. And I feel like I have a personal connection to the book that we're going to talk about tonight. It truly stands out as a kind of beacon for me, shining some light on a very profound moment in the single payer movement. I was reading Deadly Spin on a flight to DC with our field director, Georgia, to attend the very first public hearing for Medicare for All. And this book just exposed the worst of this industry. And it really highlighted the power of decades of slick PR. And it was on full display by the opposition in that hearing. But more than anything, I was really struck by the bravery of Mr. Potter. So our esteemed guest began his career in journalism, covering Congress, the White House, and Supreme Court for Scripps Howard newspapers. And he was enticed into a PR job and spent more than 20 years in the health insurance industry. Since resigning as head of corporate communications for Cigna after a crisis of conscience, Mr. Potter has written 3 books, including the one that we're going to talk about tonight. Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. So welcome to the Whole Washington Book Club, Mr. Potter. Great to have you here tonight.
Jim, thank you so much. I really appreciate this. I love Washington. I've been there many times, although unfortunately not recently. And I hope that I'll have a chance to come back and see you all in person before too long. Thanks for your kind words about Deadly Spin and the work that I've done since I left Cigna. Um, I I'll talk for a few minutes, but I'd really prefer if it works with you all to have a conversation. I'll talk a little bit about the book and what's happened since that book was published now 10 years ago and where we need to go from here. Um, I'm going to start by reading a blurb that Howard Dean wrote for the book. He wrote that the recently passed healthcare reform bill did many good things, including making health insurance available to more Americans and restraining some of the most egregious practices of the health insurance industry. It also forced more people to become customers of that industry. What the bill did not do is reform the healthcare system. Wendell Potter explains why not and what went wrong. And that is what I tried to set out to do. And I will say that I was um, supportive of the Affordable Care Act at its, even though I knew that it was very, very flawed, that it took so long to get that legislation close to passage that to start all over would have been just, in many ways, catastrophic for so many people who needed relief from the abuses of the health insurance industry. And I know many single payer Medicare for all advocates would now agree with that. And I know some that are alive today because the Affordable Care Act allowed them to get health insurance. But it didn't go nearly far enough. And one of the things that hasn't been disclosed nearly enough, although I tried to do it in Deadly Spin, is just how the industry was able to write big chunks of that bill and how the industry has profited from the Affordable Care Act. I'm working on an op-ed that I hope will be published in the coming days, just looking at that and how the insurance companies have profited and how they've been able to grow and insert themselves more directly between their people's doctors and themselves than ever before. These companies have erected barriers to care that make it increasingly difficult for people, even with insurance, to get the care that they need. And we never can lose sight of the fact that at least 30 million of us still don't have health insurance in this country. I testified before Congress several times before I wrote this book, and one of those appearances was before the House Democratic Policy and Steering Committee at the request of Speaker Pelosi. And I said during that hearing that if they pass the bill without a strong public option, they might as well call the bill the Health Insurance Industry Profit Protection and Enhancement Act. At that time, as you may recall, the public option was as good as we were going to get. There was a lot of support for Medicare for all. We called it, most people were just talking about single payer back then. It's the same thing, more or less. But then there was not given very much consideration at all. In fact, some advocates for Medicare for all, for single payer healthcare, were actually thrown out of a Senate hearing and put in jail because they disrupted a Senate hearing. That was a committee hearing, the Senate Finance Committee that was chaired by Senator Max Baucus of Montana, who in recent years has said that he believes single payer health care is the way we need to go in this country, but he certainly wasn't there then. But we have found out since the Affordable Care Act was passed that yes, it did do some good, a lot of good. But it has fallen far short of where we need to be and where we need to go with our healthcare system. We have, again, not only 30 million people who lack health insurance, and it's more than that because a lot of people lost their insurance and their jobs during this pandemic, but at least 60 million Americans are now underinsured. And a lot of those people are people who have enrolled in the Obamacare exchange plans. About 40%, according to the Commonwealth Fund, are underinsured because they have enrolled in plans that have such high deductibles that they can't get the care that they need. They can't afford their insurance. They can't afford to pay for the care that they're obligated to pay for before their coverage kicks in. There was an article in the Philadelphia Inquirer. I'm in Philadelphia, where I live, just this weekend that said only 4 in 10 people in this country could afford to cover an emergency bill of $1,000. And people are in high deductible plans with deductibles just for an individual of thousands of dollars, and for a family, many thousands of dollars. The insurance industry was able to make sure that they were going to be able to push more and more of us into these high deductible plans so that we would be underinsured and they would have to pay fewer claims when we got sick. And that's why you have more and more Americans who have insurance who have to turn to GoFundMe or to go to bankruptcy court because they have high medical bills. These companies have erected barriers to care, as I mentioned, that include not only these high deductible plans, but make it very difficult for us to get the care that our doctors say we need because of more aggressive prior authorization requirements. In other words, insurance companies make doctors jump through more hoops to get permission to treat us, as those doctors know that we should be treated. And they increasingly are kicking doctors and facilities out of the networks that they have. More and more doctors are off limits to us. And that is what, folks, has given rise to surprise bills. It hasn't been very widely reported, but the reason we have surprise bills in the first place is because insurance companies have been allowed to have their own proprietary and ever-changing networks of doctors and facilities. So there's a lot that we have to do. As I was looking at what has happened in the last 10 years and how insurance companies have profited, I was just doing some math and I looked at the disclosures of the health insurance companies over the past 10 years. And I looked at the biggest companies in this country over the past 10 years. In 2010, when the Affordable Care Act was passed, none of the big insurance companies were among the Fortune 520 biggest companies. Now, 2 of them are. And you might be surprised to know that CVS Aetna is now the 5th largest company in this country after Walmart, Amazon, ExxonMobil, and Apple. And then you have CVS Aetna. United Healthcare is now number 7, just right behind Berkshire Hathaway, Warren Buffett's company. All these companies have risen up to be among the largest corporations in this country, and they've grown increasingly big through mergers and acquisitions. The government has paid very little attention to what these companies have done since the Affordable Care Act was passed. There's a company that was ranked, I think it was 486th in the Fortune 500 in 2010. That company is called Centene. Now that company is number 42, and it has grown by acquiring a lot of smaller insurance companies, a lot of its competitors, to be able to be one of the 6 largest insurance companies in the country. A huge percentage of what we spend on healthcare in this country now flows through just these 6 largest companies. They're United Healthcare, CVS, Aetna, Cigna, where I worked, Humana, where I worked, Anthem, and Centene. We spend about $3.8 trillion, which is at least $1 trillion more than we were spending on healthcare in 2010. And a huge percentage of that flows right through these companies. They've not only acquired their competitors, but they've gotten more and more into healthcare delivery. Some of the biggest mergers and acquisitions have taken place just over the past 2 years. Cigna has merged with Express Scripts, a big pharmacy benefit management company. Aetna has merged with CVS. That's why it is now the 5th biggest company in this country. United already had a big pharmacy benefit management company, but they're also getting into healthcare delivery. So they're more and more involved in our healthcare system and our lives than they were 10 years ago. So we've got to really call on Congress to really investigate what these companies have become. I'm working with members of Congress to do exactly that. Members of Congress, both on the House side and the Senate side. I'm working with a member of Congress who's a senior member of the House Energy and Commerce Committee. To begin that kind of investigation. Over the past few years, the pharmaceutical industry has kind of been in the crosshairs of the media and public policymakers. Insurance companies, not so much. And they've been given kind of a free pass. And during this time, they have just grown like Topsy to become these enormous entities. And I have become a more vocal advocate for Medicare for All than I was 10 years ago, because I've come to realize that these companies, if they're not restrained, are just going to really take over our healthcare system. They already are extraordinarily entrenched in our public programs. It might surprise you to learn that United Healthcare and the other companies, but United in particular, is getting most of its revenues now, not from the private sector, not from individuals and from their employer customers, but from the government through their Medicare Advantage plans, their Medicare supplement plans, their Medicaid programs that they manage around the country. They take in more from the government, 2.5 times as much now from the government as they do from private payers. So they've got their tentacles deeply into our public programs. And the media has just been paying scant attention to this, and so have policymakers. So my mission, my goal for this next year is to raise the awareness of what these companies have done and how they've grown and how they've insinuated themselves more deeply into our government programs and into our lives. And what are we going to do about that? In the last couple of years, I've started 2 nonprofit organizations, the Center for Health and Democracy, and thank you, Georgia, for giving that shout out in the chat. I really appreciate that. We exist to do exactly what I've been talking about, to raise the awareness of what is happening to us and what Congress needs to pay attention to, and the Biden administration needs to pay attention to. And also to focus on how these companies are able to get away with this. My last book is called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that book goes a bit further than Deadly Spend to describe how these companies spend enormous sums of money to influence elections and public policy. Just during the past Congress, 2019 and 2020, these big insurance companies that I mentioned and their trade associations spent $65 million just lobbying in Washington. And there was no big legislation before Congress during that time. So just think of how much they're going to spend now that we have Biden in the White House and Democrats in control of both houses of Congress. They will spend enormous sums of our money. The money they're spending is our money that we pay in taxes or premiums. And a big chunk of that is just skimmed off to support their lobbying campaigns. We've got to expose that, and we've got to insist that Congress and the Biden administration really get serious about moving us in the right direction. I can't say that I'm hopeful that we're going to see Congress or the Biden administration move toward Medicare for all during the next year or two. But we as advocates need to push for that. We need to be redoubling our efforts to explain to the public the benefits of Medicare for all and how we can, as a country, spend far less for healthcare and get far more than what we're getting now, instead of just handing our healthcare system over to these big companies. And the only people who are really benefiting from that are their shareholders and their executives. You may have questions. I hope you do. But I can talk all night. But I'd like to just kind of have a conversation with you all and try to fill any questions you might have and just have a conversation. What do you think? Is that okay at this point?
That sounds great. We actually have some questions that the three of us put together beforehand, and then we have a few questions I've already seen in the Q&A section and in the chat. So I do appreciate what you just said about Medicare for all, and that's why I think whole Washington's been really focused in the last few months of the state plans that we have. We got our bill introduced into the Senate, which was really, really exciting. We have a bill SB 5204, 7 co-sponsors, which is more than twice as many than we had before. So that's great. I feel like in this time, more than ever, people are understanding that we need to move away from employer-based insurance. So my question is really about local politics here in Washington State, because we in Washington State, actually, corporations can directly donate to legislators. So we have 2 Democratic chairs of the healthcare committees, both in the House and the Senate, and they take a bunch of money from private insurance companies and pharmaceutical companies. So my question for you, and also not coincidentally, I think, they have never let a universal healthcare bill out of committee, let a universal healthcare bill even have a hearing. So my question is, what advice do you have for grassroots organizations like Whole Washington to combat the quid pro quo between legislators and healthcare or health insurance lobbyists, rather?
You know, I think it's calling attention to that flow of money and follow the money. And it is hard to break through. I frankly would be I'd be happy to help if my lending my voice can help show how this money is influencing public policy and keeping that legislation from moving out of committee. Call on me, because one of the things that we're going to be doing at the Center for Health and Democracy, and we can maybe do this specifically for Washington, to take that on as a project to show how these legislators are taking money from the special interest. And that's going to be a big part of what we're doing. That's why democracy is part of our name, is to help people understand why it's so hard to move forward. And the reason, as you know, as you've explained, is because these lawmakers, even on the Democratic side, are taking huge sums of money and blocking legislation from moving forward. It's important for the public to understand that. You can't rely on the traditional media to do that anymore, if ever. So that's step one. And I think just keeping up your advocacy and writing letters to the editor, writing op-eds, doing all the things that have traditionally been tools that we have available to us. But don't be shy to call on me. I'm working with some lawmakers in Colorado and Nevada on some issues that they have. So maybe separately, just reach out to me. And if there's anything I can do to be of help and lend my voice to what you all are doing, call on me.
That would be amazing, and I definitely will, because we need a lot of help fortunately, in Washington State, we have what's called the Public Disclosure Committee, which documents every single donation that these legislators get. So it's really easy to do that research and find when they've taken money from big insurance corporations. So thank you. I really appreciate that answer.
You're welcome, and I'm sincere. I'd like to be of help if I can be.
Well, I've got a question. So first of all, what would you call Partnership for America's Healthcare Future? Are they a lobbyist group? Like, what would you call them?
I call them a front group.
A front group.
Yeah, and a propaganda shop. It is exactly that. It is the kind of organization that in my old job in the industry I used to work with time and time again. Every time there is, from the industry's perspective, some threat to the status quo, the entrenched special interests will come together and throw a lot of money at an organization that they will name like the partnership that makes people think that it's a real grassroots, civic-minded organization to bamboozle the public. It's a lying organization, is what it is. And it's getting money primarily from big insurance companies, big pharmaceutical companies, big hospital chains, and medical device manufacturers to mislead the American public and to campaign in various ways in Washington and the states to try to defeat any efforts to move forward with healthcare reform. They have a vested interest in protecting the status quo. And while the insurance companies and the drug companies and the hospital companies will publicly point the finger of blame at each other, behind the scenes they work together because they have a symbiotic relationship. The status quo works well for all of them. And it's notable that the American Medical Association was an initial member of this organization, but it dropped out. And it dropped out because of pressure from a lot of doctors and medical students, and from members of this organization you all probably know, Physicians for a National Health Program, which helped organize an effort to persuade the American Medical Association to drop out, and it did. But it's a front group. It takes in a lot of money. It's taken in millions of dollars in assessments, they would call it, from the big insurance companies, big drug companies, to campaign against reform. They were very active in the early primaries last year. In Iowa in particular, at some points they were spending more than the Democratic candidates were spending in Iowa to mislead people about both Medicare for all and the public option. That's what they're going to continue to do. And you can rest assured that they are going to be ready to pounce if the Biden administration and Congress decides to move forward in some meaningful way with either a public option or Medicare for all. It is a shop that is run out of a big PR company in Washington called Forbes Tate. So if anyone ever asks you, or if you have the opportunity to tell people what it is nothing more than an industry front group in which these big entities have pooled their money to protect their profits. That's all it is.
Well, I've noticed that they're really consistent in their messaging.
Yes.
And they seem to lean heavily on a couple of concepts. One, that the current system protects patient choice, and that the other one is that what we're all fighting for is a one size fits all type of plan, and they use that term in a very negative light. When to me it kind of almost sounds positive, like, one size fits all of us. Like, I'm just wondering, like, do you have any recommendations how to respond to that kind of rhetoric?
You're very perceptive because those are, sorry, my dog is sharing the office here with me tonight. That's Charlie.
Yay, dogs. We're pro dogs.
But those are two things that they rely on, and they manipulate those words. The choice word. And I wrote an op-ed last year for the New York Times to try to describe how the industry has taken that word to twist it and use it to the industry's advantage. Uh, they conflate what we want to have in terms of choice, which is choice of doctors and hospitals, with choice of health insurance providers. We don't care, I don't think, as Americans, that we have the choice of health insurance companies. What we really want is broader choice and unrestricted choice that Medicare for All would provide of doctors and hospitals, those who actually provide care. But they want us to think that this would take meaningful choice away from us. So they're very skillfully using that word to make people think that something important would be taken away from us. When the opposite is true. And as I said, I explained that in that New York Times op-ed last year, and I'll be continuing to write about that. They are very, very skillful at linguistics and message testing, and I know this from my years in the industry. None of those phrases are thrown out there just to see if they'll stick. They're tested in focus groups. And the other one that you mentioned, one size fits all, was very carefully constructed because they think that Americans, and they know this from those focus groups, are concerned that if we take away the choice of health insurance companies, that something bad will happen. That choice is important. And I will tell you this, though, that at the heart of that phrase, that we don't want a one-size-fits-all healthcare system, it's racist and it's classist, because they want people of means to think that if everybody has healthcare, has access to quality care, if there's more equality in our healthcare, that somehow those who are now privileged might not be as privileged tomorrow. So know that it's extraordinarily racist. And I'm going to be writing about that as well, too. So let people know that. That's what they're really doing. It's a dog whistle, is what it is, to be quite frank with you. How do you counter that? It's more difficult because those terms are easily said. It's much easier to condemn a proposal, to advocate against it, than it is to explain the benefits of something that you're proposing. It takes more words. And we who are progressives haven't really figured out exactly how very concisely to say what needs to be said to win people over to our side. And I will say sometimes I think we've made some mistakes by thinking that some of the things we say all the time will resonate with everybody. God loved Bernie Sanders. But he always says healthcare is a human right, or healthcare is a human right. And I believe that. I think everyone here believes that. Not everybody in this country believes that, and they find that offensive. And again, it relates to that one size fits all. It's part of how they understand Americans think, and they say those terms, those phrases, very specifically to get people who are conservative or kind of undecided to think that what's being proposed is not in their best interest. And when you say healthcare is a human right, a lot of folks think, well, that means that people who are unworthy are going to be getting care that I deserve, and they don't.
Wow, it's all so illuminating. We had one more of our questions before we get to the Q&A section, so I'll just jump into that. And I really appreciated your book so much. I have an advertising background from broadcast television, and I thought the way that you set up to explain the difference between advertising and PR and the power of each was really good. I had a question kind of related to that. You know, you really outlined how big insurance and big pharma and these other organizations throw so much money into these PR campaigns to fight healthcare reform. On the other side of things, where we're trying to get through healthcare reform, we don't have these endless pockets of money and, you know, big organizations like this fighting for us. Do you think that courting an angel donor, like we've got lots of billionaires in Seattle, for instance. Do you think courting somebody with a similar mindset to fight fire with fire could be effective, or no?
I absolutely think it's worth trying to get to those folks. And I know you've got some really well-heeled people there in Washington State. I've been trying to get some of them myself. Uh, I think it's always worth the effort to get as much money as you can. We're never probably going to get us anywhere close as much money as the other side has to spend against us. They, like I said earlier, they can skim off a lot of money that we have to give them in premiums and taxes to pay for their propaganda campaigns. But we need money. We absolutely have to, and a big part of what I do is fundraising. We've got to try to persuade some really rich folks. I had by the way, a Twitter thread a couple of 3 or 4 weeks ago that one of the people who saw it and commented on it or retweeted it was Mark Cuban. So I reached out to him. We DM'd each other. I can't say that he's going to be in our camp, but getting, figuring out ways to get in touch with him. It's kind of like who do you know that knows Hanauer or whatever his name is. Some of your very wealthy folks out there who are kind of progressive, but just really haven't gotten in this fight yet. I think it's worthwhile. That said, we've just got to be smarter, and we've got to continue a lot of the things that we've done, but also realize there's some other things that we can do better. And as we were talking just a few minutes ago, messaging is one of them. And but also, again, following the money and helping folks understand this is where a lot of Democrats are getting their money from. Start a campaign to challenge Democrats or those who are running for public office not to accept any money from these special interests. It's kind of hard to get traction with something like that, but I think that's worthwhile to really make a thing out of these corporate Dems who are really in the pockets of the special interest.
Excellent, excellent. I agree that we definitely need to get more of those donations in the light, because a lot of people don't realize that these corporate Democrats are taking money from for-profit insurers and pharmaceutical companies. I had a conversation with the chief legislative aide for one of these Democrats, and she said directly, no, she doesn't take that money from insurance companies and pharmaceutical companies. And I was like, let me just pull up the PDC report for you. So she was even shocked that her boss takes the money. So we have some great questions from the Q&A section. The first one actually comes from Chris Curry, who is was on our last book club as an author of a handbook about answering questions about these very issues. So I'm happy to have him here again. He asks, how can insurance companies afford to pay so much higher reimbursements than Medicare? And will Medicare for all be able to beat those rates? Also, third part, do insurance companies provide any actual benefits or value to the healthcare system?
I'll start with the second one, and I would say no. Before I left Cigna, I was in a leadership meeting, and the CEO was asked by someone what kept him up at night, and he essentially said that he feared that the companies or employers in this country would begin to question the so-called value proposition of insurance companies. And if employers start to do that, I think that will begin to make a difference as well, too. So if you can enlist any employers, one of the other organizations, by the way, that I lead is called Business Leaders for Healthcare Transformation. We've got more than 3,000 members, including members in Washington State who are business owners or business leaders, business executives who understand that the current system doesn't work for them. And so that's very important. But I would be hard pressed if I were still in my old job to try to persuade the public that insurance companies really provide value to our healthcare system, they don't. And now that kind of relates to the first part of that question, the first question. The reason that private insurers pay more than Medicare is because they frankly have to. They are not able, even the biggest ones in this country, are not able to negotiate really favorable rates with the huge hospital systems and the big drug companies in this country. They just can't do it. They don't have the clout that the Medicare system does, the Medicare program does. But here's the other thing, they don't want to, because they're the only game in town for most of us who are not 65 or, you know, poor enough to qualify for Medicaid. We have no alternative but to deal with them, and our employers to deal with them. There's nowhere else to go. There is no public option. So they, even though they are not negotiating very favorable rates with healthcare providers, they benefit from healthcare inflation. And every time a hospital jacks up a price or something, or a drug goes up, insurance companies just increase premiums to cover that additional increase. In insurance companies, and I know this from my years in the industry, they base their rates for the next year on what they see, what they call medical trend being. And they benefit from that because as prices increase on the provider side, they are able to demand more in premiums. That is why United Healthcare took in 254% more in premiums in 2020 than 2010. Healthcare inflation, not only on the provider side, but they were able to take in more money. And that benefits them. The more premiums they take in, the more money they're able to convert to profits. So when I said earlier, there's a synergy between the players in healthcare, it's really true. Insurance companies talk a good game about trying to control healthcare costs. On one hand, they'll point the finger of blame at insurance companies and big hospital systems. So that should give you a clue why should we keep putting up with them? What is their value proposition if they cannot control healthcare costs? But then to understand that they don't want to, because the more medical inflation there is, the more they can demand in premiums. And the more money they get in premiums, the more there is to convert to profits and to increase their profit margins. It's a game.
Excellent. So the next question comes from Patty Harvey. An argument we hear is that changing to single payer would be too disruptive in many ways, specifically for the zillions who work for health insurance companies. We know that the bills in Congress provide for re-education and placement of workers in a huge single payer system, and the skills and experience of such workers should be needed in many other industries, she would think. But is there any other response to that complaint that you can think of?
Well, first of all, yes, insurance companies do employ a lot of folks. They also employ a lot of doctors who could be delivering care again, and nurses. They have United Healthcare. You may not know this, not many people do. United Healthcare, an insurance company, is the largest employer of doctors in this country. They have been systematically buying up physician practices, and they have a lot of medical directors. They employ over 50,000 doctors. So a lot of those people, those doctors, could go back into providing healthcare rather than being in those positions of largely saying, no, we're not going to cover that. They have tens of thousands of nurses that they've taken away from providing direct care to patients to work in these big insurance companies. So a lot of people who are trained clinicians by the tens of thousands are working for these companies. They don't need to be retrained. They just need to go back into providing care. It's why we have a shortage of some physicians and a shortage of nurses in this country. And a lot of the folks who are employed by these companies, quite frankly, are at the low end of the pay scale too. They are the people that in the customer service jobs that are very low pay, often paying no more than $30,000 for really horrible work. And in many cases, these these employees don't make enough money to even afford their portion of the insurance company, the insurance that their company provides. So they often take a pass on that. The problem is, of course, these companies have pockets of employees all over the country and in congressional districts, and they can always point to these employees losing their jobs. But here's the other way of looking at this. If we had a system that was more sane than we have right now, that was not tied to employment, we could have an explosion, or at least a renaissance in entrepreneurship in this country. A lot of people in this country are tied to jobs that they don't like just because they have health insurance, and they know that if they go out on their own, the chances of their being able to afford benefits that they've been accustomed to are not great. And in many cases, they just can't afford it to get insurance on their own. So our current system inhibits entrepreneurship, and it makes it puts small businesses at a disadvantage. Over the last several years, small businesses increasingly have thrown in the towel. They cannot offer health insurance. More than 50% of small businesses now cannot offer health insurance. So I think you just need to turn it around. Yes, there are people who work for insurance companies, but a lot of those jobs are nothing more than jobs to say no. You cannot get this treatment that your doctor says you need. That's what they're being paid, and paid in many cases quite well to do. And because we have this system, we're inhibiting entrepreneurship, we're punishing small businesses, and a lot of people who would prefer to start their own businesses or work for a small company or start a small company won't do it because of the burden of having to try to find health insurance on their own.
You know, I knew that that big hospital groups were doing this, driving private practice out of business by forcing them to either come work for them, or they'll push their giant advertising budgets and referral networks and put these small clinics and sole practitioners out of business. I didn't realize that the insurance industry was doing the same thing effectively.
Absolutely.
That's fascinating.
They bought up a bunch of physician practices and outpatient facilities. United has bought up a ton of both physician practices and facilities. They also bought DaVita, the big dialysis company. So these companies are deep into healthcare delivery. They've been gobbling up, and that's this op-ed that I mentioned earlier is just to explain to people and policymakers and the Federal Trade Commission, this is what's been going on when you haven't been paying a lot of attention. These companies have become behemoths, and their mergers and acquisitions have been enormous over the past 10 years, both what you call horizontal integration, they've been buying other insurance companies, but also vertical. They've been buying physician practices and pharmacy benefit management companies to be just enormous companies.
Something kind of similar is happening in Washington State, where like religious hospitals are buying up other hospitals. And so you'll find an area where the only hospitals are Catholic run. And in Bellingham, that created a huge issue because they were denying reproductive care to people. So that's one of the reasons why I support Whole Washington, is so that, these hospitals, these providers in rural areas like where I live won't have to struggle with the fact that there aren't very many insurance plans, if any, and they're going bankrupt and either shutting down or they're being bought out by these religious organizations.
That's a good point, and I will make this other point too. I'm not going to defend the consolidation on the hospital side, but I will say this: in many cases, it's been in self-defense, because as these insurance companies have gotten bigger and bigger and bigger, hospitals have merged and they've become much bigger entities than they used to be, partly just so that they can have more clout as they're negotiating with insurance companies. If they stay small, they'll get crushed.
That makes sense. So the next question comes from John Ramsdell. It is my belief, and this might get a little sticky, but we don't shy away from, topics like this in Washington. I know there was a recently last weekend, Healthcare Now had a big conference and there was a big debate about public option or not public option. So this question is related to public option. It is my belief that a public option also falls short of meeting the healthcare needs of Americans. Please share your thoughts on the public option that Biden, Buttigieg, and others supported during the Democratic primary, excuse me.
I share that concern or that belief. But here's what I also believe. It is going to be really, really hard to get Medicare for all achieved in the next 2 years. And I know that there are a lot of folks who think that a public option doesn't go nearly far enough, and it may not be something that puts us on the path of Medicare for all. Where I come out on this is that we need to make sure that people right now are getting the help that they need. And that's why I ultimately decided to support the Affordable Care Act. 10 years ago, the public option was the best we could possibly get. I'm not a big fan of the public option. However, we may see that legislation begins to work its way through Congress that would establish a public option. So what are we going to do if that indeed happens? One of your Congresswomen, Pramila Jayapal, was on the Biden-Sanders task force, and I know that she is one of the most ardent supporters of Medicare for all in the country, and has been, I think, very effective as a leader of that legislation. But she had to compromise. She could not persuade that task force to endorse Medicare for all. They wound up supporting or advocating for a public option so long as it's structured in a certain way. And if it's structured in a way that it's actually administered by the Medicare program, that it doesn't have high deductibles, that it's able to negotiate for prescription drugs like the Medicare program does, if you can set it up like the Medicare program, let's take a look at it. Let's see what it would look like. But if it's not, I'll be the first to say we cannot go that way. There are some who are advocating, well, let's just set up a public option. It could be like a Medicare Advantage plan and let even the private insurance companies be a part of that. Absolutely not. And it cannot be anything that saddles people with, being essentially junk insurance that makes people pay a lot of money out of their own pockets and have limited access. So it depends, in my view, on how it's structured and whether that puts us on the right path toward Medicare for all. I think that can be done. I know a lot of folks don't like the idea of trying to get to where we want it to be through an incremental approach. But I think, considering who is now the president and the makeup of a lot of members of Congress, we probably will not see the Medicare for all bill working its way through Congress, regrettably, this year or next. I don't know, it could be wrong. But let's just see if a public option is proposed, what it would look like, and then make our decision at that point.
Mr. Potter, do you think that a public option would benefit insurance companies by public option accepting the sickest and the poorest, and the insurance companies being able to, their customers being the healthiest and most affluent?
It's a real danger. It is absolutely something that could develop the possibility of adverse selection. That's why we have to be very cautious about this. And it could indeed be that it would attract the sickest. On the other hand, let's look at this. You've got a situation in which people who have chronic illnesses are in plans with high deductibles. I was on the phone just earlier this week with people from the Leukemia and Lymphoma Society. I'm talking in a few days with people with the American Cancer Society Action Network. A lot of people have no alternative right now but to be in health plans that have high deductibles. They cannot get the care that they need. These are the sickest among us. It would be, yes, adverse selection. It'd be terrible for the public option to be loaded up with folks who have chronic conditions. But my God, let's think about those people. let's not think about this so much in the abstract. That might be a godsend for a lot of folks. It would make the public option, yes, costly for more costly maybe, but it could be a savior for a lot of people. A lot of people with chronic conditions right now, with the Affordable Care Act in place, are dying or turning to GoFundMe or bankruptcy court because they can't get the care that they need. They need to have an alternative, and your premise is absolutely correct. We need to guard against that to make sure that at least the funding for a public option would anticipate that a lot of folks who are underserved, who are underinsured right now, would obviously prefer to have a public option without high deductibles. So it's a concern. But I know so many people who have chronic conditions who are really struggling financially to get the care that they need right now.
I appreciate what you said about being vigilant about what the actual bill says, because here in Washington State, we had Inslee talking about his public option bill, which was Cascade Care. And it actually was only available to people who currently get their insurance through the exchange. And it was the HCA contracting with for-profit insurers. So it resembled nothing like a public option should. So I do appreciate that we should be very, very cautious about what the actual bill says when they come out with it. So
yes,
thank you for that answer.
Say it's not good enough if it really is just going to be a gift to the industry. The public option, as it was almost working its way through Congress 10 years ago, was weakened and weakened and weakened. And even when President Obama spoke in a joint address to Congress in September of 2009, he was saying positive things of the public option, but then he said that it would only be available to about 5% of the population. That's not good enough. So we can't let that happen again. We can't let the industry whittle away at it and make it meaningless. So if it is proposed, we have absolutely got to be certain that we're holding policymakers accountable and say, this is, if it's not good enough, just tell them this is not going to fly.
Thank you very much. I think I got rid of that frog in my throat, but it might come back. I have really bad chronic allergies, so I apologize for that. Maybe Blaine and Jen can ask the next few after this one, just in case I get, choked up again. So this next one is from Michael Goodman. And he asked, would you agree that if the present pandemic doesn't result in Medicare for all, that we might as well throw in the towel?
Never throw in the towel. My gosh, I'm in this for the long haul. And a lot of folks have been in this for a long haul. We want things to happen right away. It's hard. It's hard to get transformative change. I was a reporter in Washington for my first career, and just don't give up. Don't lose your fighting spirit just because it takes more time and you have these setbacks. We've made so much progress. 10 years ago, like I said, people were being thrown out and thrown in jail just for advocating for Medicare for all 10 years ago. Over the past 2 years, we've actually had hearings, as you all noted, for Medicare for all bills, and we will have some more. And you've got more than half the Democratic caucus now signing on to the Jayapal bill. You've got Bernie's bill having a lot of support. Those bills are going to be reintroduced, by the way, next month. So we've made a lot of progress. In the whole scheme of things, it's not a whole lot of time. In our lifetimes, maybe so. I may not live to see it, but that's not going to discourage me from staying in this fight, because we've got to do that. If you don't do that, you're just literally throwing in the towel and letting the industry win. We cannot do that. So thank you all for your tenacity. Never give up. You can get discouraged. You will get discouraged. You'll get disappointed. But just keep going.
Well, I guess I'll keep going asking questions. So Robin Sanders, Lang Sanders, one of our great volunteers from the Seattle area, asked about doing a billboard campaign if marketing like that would be helpful for an organization like Whole Washington.
Yeah, I think it could be. You have to figure out what to do with your scarce resources, and resources are always scarce. Is that a good way to spend them? I honestly don't know. I think one thing I would encourage is to think strategically. And Blaine, you have a marketing background, a sales and marketing background. One of the things I've observed since I left Cigna and as I've been a part of advocacy groups and this whole effort, uh, advocates don't really think strategically, and they're not necessarily thinking about the best ways to use scarce resources. That could be a good way to make sure there is awareness, and it could be a very cost-effective way to do it. I would not say categorically that that is the best way to spend your money. It's always good to keep your effort in front of the public, and a lot of people do see billboards. Is it the best use of the money? I'd have to, I guess, have to take a look at some alternatives as well too.
I would echo that and just say that in terms of advertising, maybe in short bursts, but over the long run, it's important to remember that advertising inventory, whether that's outdoor or broadcast or cable or even digital, is a limited inventory. And you could have the industry come in and essentially price out they could come in and buy so many ads that they drive the price of all of that up out of our reach. We saw Michael Bloomberg do that in the primaries, where he bought so much digital advertising that actually raised the cost of ads on YouTube and that sort of thing across the world. I mean, so it's so for a small organization like this, your point is well taken about limited resources.
Well, some of us have got really creative this last year to get the word out about our organization. I've always been so frustrated that the press doesn't talk about initiatives or bills or legislation at all. They ignore it, but they love to interview candidates. So a few of us, including myself, decided to run for office. So I was able to get lots of interviews that way. It was not very comfortable for me because I don't really like to be in the spotlight, but it was worthwhile because I did get to talk about whole Washington and one-payer states and Medicare for all.
Well, Georgia, thank you for doing that, and that's what I would encourage more people to do. It is important to get beyond what you're comfortable doing.
Yeah, and like I said, I mean, it was like the day after I filed, I got a phone call from Spokesman Review asking for an interview. But I've been like sending them emails about whole Washington for years, not a blip on their radar. So if anybody on this phone call wants to run for office, I would very much help you out with that. If you run on a whole Washington platform.
I would encourage that a lot, and thank you for offering yourself up. And don't try it again sometime. I'm sure you saw it as good training. You learned a lot. You learned to deal with the media. Most people are scared about doing something like that. So it's important to offer yourself up and to learn some new things. When I started doing this, even though I was in PR, I hated being in front of the camera. I hated doing what I'm doing now. I hated giving speeches. You just get used to it. It becomes part of who you are and what you do. So at first it's scary as hell, but then you sort of get better at it.
Yeah, I definitely am less nervous than I was last year talking to people. So I think we have about time for one more question. It's 6 o'clock now, so I want to respect everybody's time. But Walter Carpenter calling from Vermont. Actually, he's the person who helped connect us. So thank you so much, Walter, for being here and making this all happen. Really, he says legislators are always afraid of raising taxes. They know that raising taxes does not get them reelected. So they always say it is too expensive to get them out of doing Medicare for all. How do we advocates break through that to show the public that this is in their best interests to force politicians to do it?
It's probably one of the most difficult things, and Walter knows more than most because he lived through it in Vermont. and he knows that the industry will play the tax card. The jobs card we heard earlier, they play the jobs card. They play the tax card first and very effectively. We've got to get people to understand, to shift their thinking. You will not be paying any more money in premiums to insurance companies. That is what you've got to get people to understand. It's hard, but that if I were to say throwing resources at anything, it is to help figure out how you can persuade people to have that shift in their thinking. They can get rid of these private insurance companies that are always saying no. They can spend less overall and get better care. Yes, don't think of tax as a four-letter word. Think of it as, yes, when you are having a public Medicare for all system, it's going to be financed with public money. Use terms like that, public financing, not taxpayer supported. But that's something advocates have wrestled with and have not done an adequate job anywhere, in my view, of figuring out how to persuade the public and lawmakers. It takes time, it takes some money, and the insurance industry plays that card all the time very effectively. But that, if there's anything that I think you have to do, is focus on how to help people understand that shift in their thinking. They can save money, they can spend less, they can get better care.
Yeah, I think one of the things that is unique about the whole Washington campaign is we worked with the Progressive Coders Network to develop a tool called the Savings Estimator, where somebody can actually put in how much they're currently paying for insurance, and then they'll see how much they'll save if the whole Washington Health Trust passed. So that's a great tool on our website, wholewashington.org. I know when I was collecting signatures, that was the number one question. How much is this going to cost me? And to be able to pull up my phone and type in their numbers and show them that they're going to actually save money was a great tool. So that would be something that I would encourage other organizations. If you're on this call and you're with another organization in another state, look into that tool, because it was great for us.
Okay. This tool is very important.
Thank you. Jen and Blaine, do you have any closing? Finding the mute button.
Yeah. No, I'm grateful for all the insight, Mr. Potter. You've given us so much to think about.
Thank you, Jane. Thanks very much. I really, really appreciate this opportunity. It's good to see you all.
Good to see you.
It's an honor for me to be a part of the work that you're doing. I really appreciate this, and I hope that when travel is possible, I'll get to see you all in person before too long.
That'd be great.
I'll just reiterate: take me up, take me up on my offer to be of help if I can be.
We will definitely do that. I'll probably be writing you an email in the next few days, actually. We need some help on strategy and marketing and that sort of things.
Sure. Thank you. Thank you all. Good to see you all.
Thank you so
Have a great night. Thanks for joining, everybody.